Hi, I'm Dr. Julie Steinauer, and we're going to talk about a really cool thing that we do in our office. Now, lots of people contact us and say, I've read about syntonics, or I've heard about syntonics, or I've watched your YouTube videos about syntonics, and I want to know, can we actually use this? Is it safe? Is it effective? Can you use it for infants or toddlers? And how do you do that? Well, so here's the thing. I have got tons of filters on my desk. I'm just going to grab some, hold them up. Maybe, if I can. Okay, look. There's lots of them. These things are so cool. They're literally probably about my favorite thing to do ever with patients is use photo-syntonic light therapy. But how do you wear them for someone who's like 2 or 6 months of age? What if you've got a baby who has an eye turn or nystagmus where the eye wobbles and we want to try to do something about that? What do you do? Well, now I'm going to show you. So glasses come off. These glasses go on. We call them goggles. Okay, now with these goggles on, all I can see is just barely some blue on my phone because this is really dark blue. So I need to take them off because I can't do a video this way and know what I'm talking about. Now, if you have someone who's little and they require syntonics to be able to make some changes with their vision, what's really cool is in our office we do something that's called the Surrogate syntonic method. Now this method is pretty awesome, and I just have to say I don't even know where I learned this at. If someone taught me how to use it, they may have, or who knows where it came from. But we've been using this for approximately 10 years with really good success. Because the thing is if you've got someone who's really young, like 6 months of age, they're too small. They're either gonna rip the glasses off or the glasses are gonna fall off. They're gonna stay on my big melon, but they're not gonna stay on the head of a really small child. So what you do is mom or dad, whoever the caregiver is, that we can make consistently doing this, and by the way, consistently have a good attitude while they're doing it, they're going to wear the glasses and look at a light. And then baby or toddler is going to stay in direct skin-to-skin contact with you. Now, what does that mean? Well, it just means that you can have them in their shorts, maybe in their diaper, or maybe you're just holding their hands. But we think about this almost back to your like electrical circuitry you may have done at some point in high school or college. But in electrical circuitry, it's like we want to complete the circuit. So I believe, and the way that we do things is that we want to touch on one side, so maybe we're holding their hand over here and their other hand over here. Or maybe it's feet to feet where we've got our feet up against theirs, where they're laying on the floor doing tummy time and playing with something, and we've put our feet against theirs. And we're the ones who are looking at the light with the colored goggles on. The baby's doing whatever it wants to do and playing, and they're getting electrical energy and information from the glasses that's passing through the surrogate person, who would be mom or dad, into them, and they can do whatever they're doing. It's safe, it's effective, and we have really amazing results with this. So now if we're treating something like nystagmus where the eye wiggles or wobbles, and I've got a baby who's really too young again to be wearing these, but I know that through syntonics we can probably decrease that wiggle wobble of the eye, or nystagmus as it's called, by about 80%. Why do I want to wait? I don't want to wait. I want to actually start working on that person early, even if they happen to be only 6 months or 4 months of age. And this is where, again, mom or dad can act as what we call the surrogate. This is a super cool method. Again, it's super safe and it's effective. We have awesome results with it. We've been doing it for about 9 to 10 years, in fact, with really young kids. And I think we probably have about 6 or 7 that we're working with right now at the present moment who are doing this kind of therapy with our office. Now, if you happen to know an infant or toddler who has an eye turn and maybe they're not wanting to seek out surgery options, or maybe they had that nystagmus, which is like the wiggly wobbly eye that doesn't stay still, especially maybe if they look off the side or they're trying to focus on something and the eye just seems to move around. And you're like, I heard about this video, you first of all pass it along, like our video, subscribe to our YouTube channel, please, and then certainly pass this video on to someone else. We would really, really love that. Now, if you happen to not be local, then you can go to our website at visionforlifeworks.com and fill out the questionnaire there. But if you're local, give us a call at 618-288-1489, and we can talk to you about how we might be able to use the surrogate syntonic method with your child or with someone that you know. Thanks so much for tuning in, and again, pass the video on if you happen to know someone who would be benefiting from our surrogate syntonic method. Thank you.